patients have breast tenderness, sometimes there is breast fullness, patients have certain food cravings, or sometimes even aversions.
That just with TLC, tender loving care. What are the changes that are going to happen to my body now that I'm pregnant? How do you counsel your patients when they come in the first trimester and you're trying to explain to them about the changes that their body's going to go through?
Yeah, very rightly said. Usually patients don't come in the pre-pregnancy period where actually this counseling is supposed to happen. But again, whenever in the first trimester they come with this positive UPT and they're so anxious. So we need to counsel them that during pregnancy, every trimester is going to have different changes, and they need to be primed with these in advance so that they can deal with them much better. So whenever patients come to me, first of all, the commonest complaint that these patients have is nausea and vomiting, of course. So they need to be counseled that this is the most common complaint, especially in the first trimester. Appropriate medications and support from the family, they can definitely tackle. Apart from that, there is patients have breast tenderness, sometimes there is breast fullness, patients have certain food cravings, or sometimes even aversions. So these changes, they need to be counseled about in advance. They also have mood swings, and not just in the first trimester but throughout pregnancy because of all the hormonal changes. So I think the patient as well as the attendant, the husband or the relatives, need to be counseled about the mood swings that the patient is going to undergo throughout her pregnancy. And as the pregnancy advances, there are a lot of other changes that can also happen. Like, there'll be weight gain, there'll be frequent urination, stretch marks.
That's generally that's what comes around, and I think those are things. I think the first 3 months is the most crucial, where they are most afraid of these changes happening. And Bela, I think you brought up some very good points, because morning sickness is something that plagues almost a majority of women. There are very few women who actually manage to escape it. And I think you said it beautifully, that just with TLC, tender loving care, and a few of the medicines, they can be managed beautifully.